Did you know that thousands of lives can be saved annually if people know the warning signs of a heart attack? Many believe that a heart attack always begins with a sudden and intense pain in the chest, but the truth is that weeks before the event, the body can emit subtle signals that go unnoticed. Recognizing these signs in advance can make the difference between life and death, enabling quick and effective medical intervention. In this video, we will explore the 6 main signs of a heart attack that can appear up to a month before. And if you stay with us until the end, we will reveal which of them is the most ignored, a detail that could save your life. 6th sign, unusual fatigue. Persistent and extreme fatigue can be an important but often ignored sign that the heart is struggling to efficiently pump blood around the body. Unlike normal tiredness at the end of a day, this fatigue is characterized by a feeling of deep exhaustion, which does not improve with rest and begins to directly impact day-to-day activities. This type of extreme tiredness is the body's response to overload on the cardiovascular system and can be one of the first signs of heart problems. This symptom is often observed weeks before a cardiac event, especially in women who report a feeling of overwhelming tiredness for no apparent reason. Chronic and unexplained fatigue, especially if accompanied by other symptoms such as shortness of breath or sweating, should not be underestimated, as it may be a cry for help from the heart, indicating that it is having difficulty supplying enough blood to all organs. Identifying and respecting this unusual fatigue is a fundamental step towards early prevention of a possible heart attack. 5th sign, shortness of breath. Shortness of breath during light activities or even when resting is a symptom that often goes unnoticed as a sign of an imminent heart problem. This sign can appear up to a year before a serious event and represents a condition called dyspnea, where the heart finds it difficult to maintain adequate blood flow. As a result, fluid builds up in the lungs, making breathing difficult. This breathing difficulty can be accompanied by a feeling of tightness or heaviness in the chest, and, although common, many do not associate it with a cardiovascular problem. This is an especially significant symptom in men, where persistent shortness of breath can indicate heart failure, a condition in which the heart cannot meet the body's demand for oxygen and blood. Shortness of breath can also appear during everyday activities, such as climbing stairs or carrying out simple household tasks, being a sign that blood circulation is not occurring optimally. Recognizing this persistent shortness of breath as a warning sign can be decisive in seeking medical evaluation before a serious cardiac event occurs. 4th sign, chest discomfort. Chest discomfort is one of the most well-known signs of a heart attack, yet it is often ignored or attributed to other causes such as indigestion or anxiety. This discomfort can be described as a feeling of pressure, tightness, or pain in the chest, and can vary in intensity from mild to severe. The origin of this symptom is usually a reduction in blood flow to the heart, which can occur due to the narrowing of the coronary arteries, responsible for delivering oxygen and nutrients to the heart muscle. This condition, called angina, represents a situation in which the heart is not receiving enough oxygen, which can result in intermittent or persistent chest pain. This sign can occur both during physical activity and during emotional stress, and is an important indication that something is not right with your heart health. Even mild discomfort can be a warning of a more serious cardiovascular problem, and if left untreated, can lead to a heart attack. Therefore, it is essential that any chest discomfort, especially if recurring, is evaluated by a healthcare professional. 3rd sign, frequent indigestion. Frequent indigestion can be a less obvious sign of an impending heart attack and is often confused with digestive problems. This symptom is characterized by a burning sensation, fullness or discomfort in the upper part of the abdomen, and can occur at any time. The relationship between the digestive system and the heart becomes evident when we consider that a heart that has difficulty pumping blood affects blood flow throughout the body, including the digestive organs. This symptom is especially common when blood flow is limited by a blockage or narrowing of the coronary arteries. When the heart does not receive the amount of blood it needs, other organs, such as the stomach and intestine, also suffer from a lack of oxygen and nutrients, which causes this feeling of persistent indigestion. If indigestion doesn't improve with over-the-counter medications, it could be a warning that something more serious is going on. Identifying this connection between indigestion and heart problems can help avoid a late diagnosis and increase the chances of effective treatment. Second sign, trouble sleeping. Trouble sleeping, such as difficulty falling asleep or waking up repeatedly during the night, are lesser known but important signs that something may be wrong with your heart. Research shows that sleep disturbances can be a sign of an impending heart attack, appearing up to a month before the event. The relationship between sleep and cardiovascular health is profound, as the quality of sleep directly influences the body's recovery and rejuvenation process. Additionally, conditions such as sleep apnea, where breathing stops during sleep, doubles the risk of a heart attack, causing precipitous drops in oxygen levels and straining the cardiovascular system. Insufficient or poor quality sleep contributes to increased blood pressure and stress levels, which are risk factors for heart problems. Therefore, it's important to prioritize high sleep habits and watch out for signs of insomnia or occasional sleep problems, which could be indicative of an underlying heart problem. First sign, excessive sweating. Excessive sweating, especially when it occurs unexpectedly and for no apparent reason, is one of the most common and alarming signs of an imminent heart attack. This type of sweating, often described as cold sweats, occurs when the independent nervous system responds to limited blood flow and oxygen by activating the sweat glands. This symptom can appear weeks before a heart attack, and unlike normal sweating, is not related to ambient temperature or physical activity. This sweating often occurs during rest or light activity and is accompanied by a feeling of dampness or cold sweat on the skin. This sign is one of the most overlooked, but it is a clear warning that the body is under stress, possibly due to a lack of adequate blood circulation through the heart. Studies show that excessive sweating is one of the symptoms reported by around 40% of heart attack victims, which highlights the importance of valuing this sign as a cry for help from the body. The signs leading up to a heart attack are often subtle and may go unnoticed, but they play a crucial role in preventing a cardiac event. Understanding and recognizing symptoms such as unusual fatigue, shortness of breath, chest discomfort, frequent indigestion, trouble sleeping, and excessive sweating can mean the difference between early medical intervention and an imminent risk to life. Each of these signs reflects the body's struggle to maintain its balance in the face of compromised heart function. These symptoms, in isolation, can be confused with everyday problems or less serious conditions, but it is their persistence and intensity that make them important warnings. Extreme fatigue, for example, is not common tiredness, but a sign that the heart may be having difficulty maintaining adequate blood flow. Shortness of breath may be more than a lung problem, pointing to early-stage heart failure. Chest discomfort, although most associated with heart problems, is often underestimated as just stress or indigestion. Even frequent, seemingly harmless indigestion can signal inadequate blood flow to the heart and digestive system. Sleep disorders, such as apnea, are also closely linked to heart health, while excessive sweating in anxiety reveals an occurrence of cardiovascular stress, signaling that something is wrong. Early recognition of these symptoms is essential, as it significantly increases the chances of treating and controlling the problem. With the necessary attention to these signs, it is possible to seek medical help preventively, avoiding complications that could culminate in a heart attack. Furthermore, raising awareness of these symptoms and educating the population about cardiovascular risk factors help to build a culture of prevention. Self-care and regular medical monitoring are essential for those with risk factors, such as a family history of heart disease, hypertension, diabetes, smoking, and a sedentary lifestyle. Early detection allows interventions that can change the prognosis and save lives, reinforcing the importance of paying attention to these signs and symptoms. Therefore, it is essential that each person feels responsible for their own health, observes their own body, and does not hesitate to seek help at the slightest warning sign. Heart health should be a priority, and knowing the signs of a possible heart attack is a powerful prevention and care tool.